Michael Rayner. I'm a person living with HIV/AIDS since 1995 from Broward County, originally moved down from New York. And I'm so grateful that Senator Smith asked a few questions. And Senator Broder, Tracy Stafford says hello. I'm really concerned. I'm one of those 130,000 Floridians living with HIV/AIDS and the estimated 30,000 that will be impacted by these cuts that are happening with the state's AIDS drug assistance program. The state gets about $90 million from the federal government. And then through the rebates and premium rebates that it gets, it earns another $225 million. What alarmed me, what I just heard, is that those funds are being shifted. That's a violation of federal law to shift programmatic dollars for rebates. Those must stay within the program according to the 340B program. That's a violation of federal law. The health department's also violating the rulemaking process and shutting out the community to make sure that we're aware of what these changes are coming. I'm going to lose access to the ADAP program to pay for my medications. One of the medications alone, my insurance company, CVS accidentally went to fill one, and I went to pick it up because they said it was ready when I wasn't actually entitled to get it at that moment. The cash price was $7,500 a month for a month of Prozista. I take additional medications on top of that. This program is a lifeline. It has changed the HIV epidemic from once we all know it. And I have been on Zooms. I drove up here from Broward with my dog. I'm camped out in a hotel because this is so critical to so many. I have the privilege to get up here to Tallahassee. The 130,000 people that are living with this virus in the state don't have the chance to come up here and ring the battle alarm to say this is wrong. The health department is doing something wrong and underhanded to cheat us and distance us from critical life-saving medications. They're also canceling this at a time where open enrollment ends tomorrow. The health department told people where they're paying their health care premiums that you had to go into a select number of Affordable Care Act plans, and they're the only ones that they would participate. They're canceling this program, and they're even telling people in the letters that I've received last night from some people, I won't even see my letter because I have to go see my family and I'll be on the road for 3 weeks, so I won't find out till February whether I have eligibility, but I won't. But they are telling people that your insurance is canceled. They're not telling people that we can't pay your premium, but you have the opportunity to try to figure out how to pay or to find another funding resource. The health department has no authority to cancel someone's health insurance. That's a state government that none of us want. It is a complete overreach. And there needs to be an investigation and a DOJ actually into the Bureau of HIV/AIDS section to make sure that this program is being run correctly. Because the shortfall of about $120 million, we think was shifted to a different program against federal law. And we're alarmed. And this morning I was really disheartened because I had a meeting set up with Deputy Secretary of Operations at the Department of Health, Dawkins, and I got an email this morning driving up here from my hotel saying that that meeting's now canceled. There is panic, there is fear, people are crying, and if you know the disease model of HIV/AIDS, you know there's a lot of co-occurring conditions. You know that those living with HIV/AIDS are suffering also from mental health issues, substance abuse issues, and more. And this depression, this fear, this anger, this fear of loss, the stigma of those who took them so long to try to get into care and treatment and reach out to people are now feeling abandoned by the state of Florida. And we need the legislature to send a strong message to the Department of Health to put a pin in it and begin to collaborate with the community, go forward with the rulemaking process, and do what the federal government says, where you need to collaborate with the HIV community of stakeholders, providers, even the county health department. I phoned them yesterday to see if I can get a copy of my letter because I'm not going to be in Broward for 3 weeks. And they said, we don't actually get copies of it. It's all coming out of Tallahassee. I won't even see what affects me yet, but I'm going to lose it because I'm above 130%. And you need to compound some of this on as well. There's going to be Medicaid cuts coming. So we're going to even have a harder time with some of the capacity. So I think with some of the things that are happening at the health department are really not what they are. And there really needs to be a lot of sunshine to see what's going on there, because there's been no communication with the community or transparency. We're afraid for our lives. I mean, listen, these medications, in the beginning, I was down to 124 pounds. I feel now as fat as a Thanksgiving turkey because of the medications. And, you know, they're giving us hope for life. And, you know, women I'm hearing that have kids and everything, they don't know what they're going to do. Now they have to make hard choices in how to figure out how to pay for their medications, their insurance premiums, the copays and deductibles. I was one of the blessed ones. I got about $2,500 of assistance just to pay for my copays. But I'm blessed and I'm privileged, and I have friends that would help kick in. Not everybody has that pleasure, that privilege. And I do need this committee and other committees on the House and the Senate to really send a strong message to the governor's office that they need to cease this. They've even yesterday told some lobbyists that they don't care about the rulemaking process. Go ahead and sue them. So we need your help. I'm available to meet with anybody. I've been making the halls, and I have to say, some of your offices, Senator Broder, your office has been amazing. The chair of the Appropriations Health staff has been amazing and listening. And I know there's a lot of concern growing. This is a bipartisan issue. HIV/AIDS has never been a partisan issue since the enactment of the Ryan-White Care Act. And this is too important. And we really need to figure out what the health department's up to and put a stop to this. I can't tell you the fear that people have. I'm getting the phone calls, the text messages from people afraid because the letters at the health department are so vague. They shut down. They're not answering phone calls at the state level. They're not giving us information. We are lost and being abandoned by this state. And I don't think that's the will of this legislature. And I really do ask and implore you to set up some type of oversight body to ensure that this is dealt with. Because this impacts my life and the life of so many others. I've gone through medication resistance where I had to change to different cocktail of medications because my body grew resistant to those. And I had a long, struggling time. And I'm wrapping up, Mr. Chair. I just want to say thank you for listening to me. I'm trying not to cry, but this is really something that has a lot of us scared. And I just have the privilege to be here, to be a voice for so many who can't get up here to sound the alarm. And I'm so glad that so many offices are opening up their doors to listen to our concerns. And I'm here, and so many of us are here to listen to, and talk to you and give you more information. But we think we know where the shortfall is, and we believe the money's been misappropriated by the Florida Department of Health. Thank you.
Thank you, Mr. Rajner, for making the long journey from Fort Lauderdale to be here, and thank you for your card. Was you were seeking information, but at the end of the day, you imparted information to us, so we thank you, sir.
I misread the card, but I thank you, and I appreciate your time, Mr. Chair.
Mr. Hooper, Chairman Hooper, permission for a brief question, please.
Granted.
Thank you, Chair Hooper. I apologize. Mr. Rajner, I think that I speak for the members of this Senate committee when I say thank you for having the courage to tell your story, which is very personal. We hear you loudly and clearly. I do have a question for clarification to try to understand what's happening. My understanding is the ADAP program is a federally regulated program that we receive hundreds of millions of dollars to fund. It's earmarked for this program, only for this program, and for no other program. If the state of Florida, based on the presentation we heard from the governor's office, has not been denied additional funding or has not been notified of changes to funding for this program, how can these dollars just not be there? How can the state of Florida say that tomorrow open enrollment ends and that beginning March 1st, it sounds like more than 15,000 Floridians may not have coverage to HIV medications? Am I understanding that right?
You are, and they can't move these funds. And David Poole's in the audience, who's a consultant with AIDS Healthcare Foundation and can speak to more of the regulation component. I'm just a simple Floridian. I have a social work degree and have lived with the virus since '95, and had my struggles with it, and have engaged in advocacy on a voluntary basis of going to DC and everywhere. And Senator Sharif has seen me enough in County Commission in Broward. And yeah, it's a violation of federal law that they are moving these monies around. And the community of advocates, and I have been on Zooms more than I can ever believe. My poor dog has been scratching to go out for a walk every time because I'm on a Zoom too much with medical professions. Last night we had almost 200 medical professionals on a Zoom freaking out about this. And it is a violation of federal law, and they can't be doing this. And that's why we're thinking the monies have been misappropriated to other purposes, and that's not what's supposed to happen. Back in 2010, Florida led the nation with the greatest number of people on the AIDS drug wait list, and that went on for about 2 or 3 years. And one of the things then, at least, I served on the Florida Department of Health's AIDS Drug Assistance Program advisory work group as a person living with HIV, utilizing the system as a consumer representative. But back then, at least, the department brought in bioethicists and worked with us in a really transparent manner. The other violation of federal law that the health department is in is they're supposed to be working transparently with the various consortia and community partners. And for the last 2 years, they've gone in complete lockdown with the failure to provide any financial transparency on the program and anything. But thanks to the CFO's website on transparency, we begin to find out where this shortfall could possibly be. We just don't know where those monies got directed to. And so this is larger than just what you're hearing from the governor's office or the health department. This is actually a clear redirection of funds, and we don't know where. And I think that the HIV section might need a Doge.
Thank you again, Mr. Rayner.
Thank you.